And today I'm sorry to announce 3 additional deaths due to COVID-19, and they're all residents of Northwood who passed away yesterday. We now have had 27 of our fellow Nova Scotians who have died as a result of COVID-19. We also have 15 new cases of COVID-19 to announce today, bringing the total number of confirmed cases in Nova Scotia to 915. We currently have 12 individuals in hospital, 3 of those in intensive care. 522 people have recovered, which is good news. That's about 57% of our overall cases have actually recovered, which is good news, and we need to be talking about that as well. We have 26,902 Nova Scotians now have been tested and have been found to be not have COVID-19. We have 10 licensed long-term care facilities and unlicensed seniors facilities that have had 1 or more cases of COVID-19 and involving a total of 218 residents and 95 staff. The majority of both residents and staff, of course, are a part of the Northwood outbreak. Yesterday, the QE2 lab processed 483 lab tests, well below their capacity, and we are in an actually envious position to have a very strong testing capacity, and we are looking at other ways that we can enhance our testing to understand more about the impact of COVID-19 and how it may have spread within our province, and you make full use of our lab capacity. And so we're actively exploring those possibilities. But I also want to take the opportunity to remind Nova Scotians that anybody who may have COVID symptoms, it's important that we get you tested as quickly as possible. So if you have 2 or more of fever, new or worsening cough, headache, runny nose, or sore throat, if you're able to go online, do the online 811 assessment and get further direction. If you don't have that online ability, calling 811 and they'll do the assessment as well, and you'll get further direction. So anybody who thinks they may have those symptoms, do the assessment because we want to test you as part of our ongoing work. Early identification of cases, close follow-up of cases and contacts is a critical part of our COVID response. I want to talk a little bit just about people are hearing other provinces and how they may be moving a plan to lift restrictions. So let me just talk a little bit about where we are at on that with Nova Scotia. I certainly want to start by acknowledging that this isn't easy, that the public health measures we have necessarily put in place have and are having significant impacts on families, on communities, on businesses. So it's important that we all recognize that, but also recognize the necessity of why we have done what we are doing. There are discussions that, as a reference that people I'm sure are aware of, that discussions across the country, certainly at my table with my Chief Medical Officer of Health colleagues, about how can we safely and slowly start to lift these restrictions. Every province is doing that work, guided by a nationally produced framework that's coming from the Special Advisory Committee where the Chief Medical Officers of Health all sit. We are using that national framework. We are working on a plan here in Nova Scotia. We've started that conversation last week and continued it today within government, but this is not something we can rush. We still have a significant amount of virus activity here in Nova Scotia. It's absolutely premature for us to open things up significantly at this time or even in the next couple of weeks. But we are looking at how we may start to take some initial steps in that direction. But it's important that people need to understand that no matter, even if you're hearing something from another province or another country, that the decisions that we need to make and will be and necessarily have to be based on Nova Scotian epidemiology and other local data. Other provinces are making decisions based on their information, but this is not a common or consistent, or the pandemic is not playing out across the country in a common or consistent way. And so we have to have a plan that works and is appropriate for Nova Scotia. As we develop that plan, once we're comfortable with it, once we have the right decisions made, then we will be able to start to share that. But it's important that Nova Scotians understand that this will be a slow and deliberate and phased process. We're going to take our time to do this so we can get it right. We'll always be watching to have the impact, and have we actually created an increased ability for the disease to transmit. And we're going to be, it's far better to, in my mind and in the Premier's mind, to be slow in this and minimize the chance of having to tighten things back up again, rather than going out fast and then realizing, oh, now we have more disease and we have to re-implement restrictions. So this will be a very phased and slow process. Any of the steps we take are going to be done thoughtfully and carefully. We have time to do this and consult, whether it's the education system, whether it's in the hospitality sector, whatever. We have now time. We can actually work with groups and businesses and organizations and get their input about how we can best do this. But at the end of the day, it's going to be all about making sure we do things in a safe and planned manner. The other thing that people have to recognize is that even as we start to lift restrictions, and if people have looked at other provinces' plans, they will have seen this, we're going to have to collectively stick with the basic requirements around social distancing, minimizing the chance of groups of people, especially large groups of people, getting together, as well as proper hygiene, hand washing, not touching your face. Those are going to be in place for months ahead of us. And because they're going to be really important, that even as we open up, whether it's the outdoors, whether we start to open up other types of businesses, that those will only be able to operate safely if they can accommodate and people are sticking with the rules around social distancing, around maximum numbers, if that's appropriate. So I think we just need to understand that the things are going to, as we talk about returning back to normal, what actually normal is actually going to look quite different for a significant length of time. This virus is with us for a long period of time. And we have to make sure we don't give the virus a chance to get a stronger foothold, even as we try to lift some of the restrictions. We will continue to remain focused on protecting those who are most vulnerable to severe COVID-19 illness, and it's those living in shared living environments, such as long-term care facilities, homeless shelters, as well as our healthcare workers and other essential workers who continue to go to work and put themselves at risk. So we need to protect those individuals and those settings while we carefully lift public health restrictions to reduce the health, social, and economic impacts. It's all about a very fine balance here, and again, this will be done very slowly and thoughtfully and carefully. As I said earlier, I just wanted to focus a little bit again on some good, what I consider good news, that we have of our total cases, 57% of those. I was wrong. I said 52% earlier, but it's 57%, or 522 of our cases have had COVID-19 and have now recovered. So it's important that we share that good news as well with Nova Scotians. But while we share that, we also don't want people to think that we're completely in the clear. We are making progress. As we look at our epidemiology, we are seeing certainly limited spread in many parts of the province, reductions in community spread in others, but it is premature again to robustly lift our public health restrictions. So we will start to look at that, but do that very thoughtfully and carefully, because we know that Nova Scotia, that the virus is here. There is the potential for the virus in all parts of the province. There's some perception that it may be just exclusive to HRM, and while we have more virus activity in HRM, it is the potential for the virus in anywhere in the province. And if we let down our guard in any one community, there is the potential for the virus to then resurge and put people at risk. So we need to continue to follow the public health directives and do that not just for ourselves, but as I said before, for our neighbors, for our friends, for our colleagues and parents, and for our and people in our communities who themselves go to work and put themselves at risk. So we just have to, and I think the key thing people need to take home is that, again, I have to emphasize that sticking with good hygiene, minimizing social interactions, social distancing, sticking mostly with the people that within what I call your home unit, people that you live with, that's going to be important and necessary for a long time to come. So we'll come forward with some more details of this plan soon, but I think we wanted to make sure that Nova Scotians understood what they can expect in the coming weeks and months. I'm just going to finish. I have a new friend on email, Sawyer Burke, who's an 11-year-old Nova Scotian, who has emailed me a number of times saying he listens faithfully to the Premier and I, and he follows our advice, and he's using that advice to actually educate his family and his community. So I just wanted to thank Sawyer for his example and his leadership about how all Nova Scotians can support each other.